Welcome to Shift Report, the podcast brought to you by mcentric.com. mcentric is the go-to information and resources hub designed exclusively for the emergency medicine community. On each episode of Shift Report, we host key leaders from the field who share their insights and experience from inside the world of emergency medicine. Our goal is to inform you, to encourage you to use what you learn to improve your practice and to improve yourself. Today, we welcome Allie Bloom. Dr. Bloom practices in the Washington, D.C. area. She received a medical degree from the George Washington University, where she also trained in emergency medicine. Today, she'll speak with a Shift Report about the subject of ketamine as a management strategy for depression resistant to other therapies, as she and two colleagues have branched out and started Capital Ketamine and Wellness to serve this population. We're recording this edition of the Shift Report at a time when ketamine is in the news. Dr. Bloom will provide us with context around safe and effective use of ketamine. Welcome, Allie.
Thank you so much. Thanks for having me.
Thanks for taking the time to share some insights with us today. You have a long experience in emergency medicine in the more conventional way, and you and some colleagues have delved into entrepreneurship and an important clinical area, and we'll touch on that. It's sort of going back in time. Tell us a bit about what brought you to emergency medicine and what has kept you in it.
Sure. So I think like most physicians, I was drawn to emergency medicine just because of the pure adrenaline and excitement, never knowing what's coming through the door. The spectrum of patients and different acuities was certainly exciting as a medical student. And then obviously the hands-on application, being able to do some procedures. And, the idea of being this MacGyver who, could do different things and different procedures and figure things out and make that first diagnosis, that really drew me to the field. When I was on medicine and the diagnosis had been established, we know this patient has pneumonia, now you're just managing it. I think being that person who makes, the diagnosis in the emergency department was very fulfilling for me. And then just secondarily, I, was a non-traditional, applicant to medical school. Following college, I ended up doing a master's in public health and health policy and management. And I was a little older, but I knew I wanted to be a mother and have a family. And I really felt the field of emergency medicine is conducive to, being able to, work a great job, but still have a lifestyle where you could be, present, for my family and my children.
That's great. And that's a set of themes that we hear frequently in the specialty. Along the way, who was a mentor or two, maybe in a non-traditional way, kind of led you to this path?
Sure. So I trained at George Washington University, just like you. I certainly had a host of mentors. The ones that stick out for me would be Dr. Yolanda Haywood. I, ended up having two children during residency, and she was such a supporter and mentor. And I really felt I could go to her. When I was telling her I was very scared and shocked at my second pregnancy. And she was just so gracious and guided me through that. Dr. James Scott is another mentor who just is so passionate about the field, and his style of teaching was just so electric whenever I did shifts with him. And certainly in medical school, I have to give a nod to Dr. Stephen Evans, who is chairman of the surgery department, who at first, I think just because he's such a phenomenal teacher and human being, I really thought I could do general surgery. And eventually I figured out maybe that's not for me, but he really was a mentor, and it still continues to be just a wonderful person who's moved to administration now. But I would say those are some of the few.
It's interesting when you talk to people from various places, certain names keep coming up, and
Absolutely.
And in your case, they certainly do. So you have practiced in a very busy suburban environment for a long time, and many years. So you and colleagues have chosen to start a new venture. Tell us a bit about that and what led you to that.
So this was actually the brainchild of one of my partners, Dr. Amy Woods. And, we all worked on the front lines during the pandemic. I think we all felt that fallout afterwards and the burnout. And one of the recurring things that obviously we kept seeing was just the challenges of the pandemic on mental health, people who already had diagnoses of depression, anxiety. And then you just, it brought on this new wave of mood disorders in patients who, went through the pandemic, very traumatic for children, for adults. And so you had people who never had a history of this, now coming in for these mood disorders. And, I think Amy, really took a look at this and said, there's one, an opportunity to help people, two, an opportunity to create something that we could call our own. And it was a nice jumping off point because, who better than an emergency physician to work with ketamine? We understand the pharmacokinetics of the medication. We understand the contraindications of the medication, and, how we need to monitor patients during this. And so that all those factors kind of played in, and she, approached myself and another colleague, Dr. Gurma, and said, I have this idea and I think it could be something that would be, not only fulfilling, but, something that could be, potentially, something that could, accentuate, our lives, be something that, that is different from just our shift work, and obviously potentially, from a financial standpoint as well, complement what we're already doing.
So we'll move on to some of the specifics of ketamine in a minute because I think they're very important issues that people want to hear about. But from an entrepreneurship and business standpoint, you're still new at this with
Yes.
Capital Ketamine and Wellness. What are some of the couple of the lessons you've learned early on, and because you didn't come to this from a business, you hadn't run a business before.
Correct. And not to be contrite, but it's the saying, you don't know what you don't know is very true. I have no business background. My father's an entrepreneur. And so I think the number one thing is you need to seek out mentors, who have done this before and know something about business. Basically, you have three emergency physicians who are trying to figure out, what type of licensing do we need? How do we negotiate a lease? Uh, how do we have employees? Are they 1099? How do we get this practice up and running? And so the lessons have been extensive, but we've learned a lot in a short time. And I think that's why it is so important. We talk about mentorship, whether it's in medicine or business, you have to seek out a mentor that you trust, and certainly a community that we found, physicians who are doing these, providing ketamine, because there's a lot of big lessons. I think the second thing is, my partners and myself, we've all been friends, we're mothers, we've been there for each other. But once you start a business, there's going to be a lot of different opinions on how we handle things. We're not always going to be in agreement. I think that kind of surprised us because we're all very similar. But at the same time, we have very different viewpoints on things. And so, as they say, don't take anything personal. It's just business. You have to, kind of remember that and set your personal feelings aside when you have partners.
It's important advice that I think anybody, physician or otherwise, who's going into a business could learn from. So ketamine is something with which almost all emergency physicians have experience, but usually as a sedative in various settings in relatively large doses, or even in use in the field by EMS and police, which has also had its own share of news. We're speaking, you and I are speaking fairly soon after the news is broken about the actor Matthew Perry and his death and arrests related to that, and the death was determined to be due to a very high dose of ketamine, which he had been taking apparently for mental health reasons, but then became addicted to and acquired through very bad means. So tell us a bit. No doubt you've had your patients ask you about this, and probably others, including me from the media and otherwise. How do you handle that when you're using it for a very different purpose?
So it's interesting. When that story broke, we had literally been open for 2 weeks, and my phone was flooded with texts about the Matthew Perry. And so, we had to wait some time for that news to die down. I thought there would be bigger implications for us. I thought that's the end of this. We've opened this business and we're going to go nowhere. But the reality is, patients who seek ketamine treatment, the majority of them have done their research. And so the patients that come to us have already read about it. They've read about other patients' experiences. I think the big thing to understand is, the doses of ketamine, that the hot word is microdosing. We're giving such smaller doses of ketamine, generally 0.5 milligram per kilogram. And it's an infusion. It's over 45 minutes. And we know ketamine is safe. It's a safe medication. In these doses, there's very low risk of any type of respiratory, depression. And so we understand that ketamine is exceedingly safe. I think what the recent news brought out is that, the infusions that he was doing for mental health purposes were not responsible for his death. There were a number of reasons for his death, but it certainly wasn't the infusion that he had. Ketamine has such a short half-life that the infusion he had wasn't even, that ketamine was nowhere in his system. But I think what it really highlights, and for this reason, is we don't do any type of oral or troches or lozenges. We don't give any prescriptions, of ketamine to patients. We will only do IV infusions for that reason, because I think it's, very important that physicians are involved directly supervising patients when they have ketamine. The idea of having these online companies that we mail you this ketamine and then we watch you take the ketamine and, it's still in your possession, but we trust you to do the right thing. I think it's just sets patients up for failure. So I was, while his death was obviously very sad, there was a host of factors that, ultimately played into his demise, getting into a hot tub, other things on board. But ketamine really is a safe medication. And in our clinic so far, we've had no issues with patients. And the reality is we understand who it's safe for and what we need to look for.
So in your practice, tell us a bit about sort of how it works. Who are the patients? What are the general patient population? And what can patients expect, or what can clinicians expect when they send their patients to you? What are you going to do, and how is that going to help your patients?
Sure. So some of our patients are self-referred. We certainly have made a lot of good connections with therapists, psychiatrists, psychologists who are referring their patients as well. The first thing we do is we do a screening, which not all practices do. We consider it very important, where we're, just like as if you were undergoing a hip replacement, you're going to have an intake or a consultation. We do a screening with patients to just go over your medical history, what medications you're taking, because there are a lot of medications that can potentially interact with ketamine. What medical history does the patient have that could be a potential contraindication for receiving ketamine? We go over their psychiatric history. We go over who's part of their psychiatric team. That's really important for us because we're very collaborative. We can tease out who's there for the right reasons typically. And so our patients are those who are suffering from treatment-resistant depression, generalized anxiety. We treat patients with OCD and PTSD. I would say those are the main ones. And that's really, although the research is in its infancy, those are the conditions that we see that ketamine has, real influence on. So once we feel that a patient is, medically cleared and it's safe for them to receive an infusion, we'll also, touch base with their psychiatric team and just make sure everyone is in agreement that this is a treatment that, could be efficacious and safe for them. And then the patient will come into our clinic. It is a 45-minute infusion. We are monitoring them the whole time, looking at, pulse ox, pulse, respirations. Every 15 minutes, we come into the room and check their vital signs. There's a physician and nurse present at all times. Some of the things with ketamine, the side effects are certainly nausea, which is no surprise to anyone, being a general anesthetic. And the second is you can see a typically transient rise in blood pressure. To date, I think no one has needed to receive any type of blood pressure lowering agent, but we have the ability to do that. And so the infusion runs over 45 minutes, and then we give patients another hour to recover. Some patients during that hour will do a Zoom therapy session to kind of unpack what they experienced. Most patients will simply just recover, and then they'll schedule a therapy appointment in the next 48 hours. And so there is what's called an induction series. Patients come in for a series of 6 infusions, generally about 2 a week for 3 weeks. And then some patients will choose to go on and do what's called a booster, which could be monthly, quarterly, or as needed when they see the symptoms of their mood disorder return.
That's great information. I think this is an area that many people know exists, but don't know much about, and may in fact be skeptical of, because it's a different thing. It sounds like you have dotted your I's and crossed your T's and ensured that you're following protocols and managing safety. No doubt, given the occasional news of either a celebrity like Matthew Perry, or I believe last year there was a case related to field use with law enforcement and EMS that's completely different from how you're using ketamine, but does use the same drug. You no doubt have scrutiny from regulators and perhaps attorneys and others. How do you manage that? How do you ensure that your practice does well and doing things in a way that can stand up to any of that scrutiny?
Yeah, I think it's a really good point, because right now the common phrase you hear about the ketamine industry is it's the Wild West. There's very little regulation. And so for that reason, you really have to do everything, above the law, I would say. So when my partners and I met, we came up with, number one, we're going to be following research, and that we're going to have protocols that follow the research, that it's easy to kind of make up your own thing right now. And, bigger is better, bigger doses, those type of things. The reality is all the research is based off of 0.5 milligram per kilogram. And so it's interesting. We've had some patients come over from other practices who are getting much larger doses. My bet is because the patient says, I didn't feel anything during that. I think I'm supposed to feel something more during that. I want to feel that euphoria. And so often we've seen some patients who are maybe at, 1.3, 1.4 mg per kg, but there's no evidence to support that. And so I think it's really important that we're following the research that's out there, minimizing risks to patients. We know the FDA is looking closely at this, certainly the Department of Justice. I think if, we're simply following, the guidelines nationally of what's supported by, research, we'll be okay. And also, I would welcome some regulation, because I know patients that we turn away if we feel they're just not there for the right reasons, or it's not safe for them, can go down the block to another facility and see another provider who often is not a physician, who will be happy to do an infusion. And we've seen a lot of, companies supported by venture capital who set up shop near us who are already out of business, within a year. And so I think there needs to be some scrutiny, and I think we would actually welcome some regulation in the space, because I think with our practice, it would only help us, because I do feel that we have the certifications to be delivering ketamine, and we're doing it in the safest way possible.
This is great information about ketamine that I think people are going to really benefit from. Back just a bit to the entrepreneurship issue, it's not lost on me that you are 3 women who are talented, skilled, very experienced in emergency medicine. What advice do you have for young women who are looking for fulfillments and opportunities in and around medicine, and what do you have to say to them that might help them as they look for how to improve their careers and their lives?
Yeah. We all know emergency medicine has such a big burnout factor just initially. And then we had the pandemic, and now we have these crushing volumes, nursing shortages, doctor shortages. I think it's really important that you find something that it sounds cheesy, but that fills your cup. And the fact that I'm, started this business with two women, we're very proud of it. It's been scary and uncomfortable, but I know, as the saying goes, you have to get comfortable with discomfort. It's brought a lot of rewards. Now we're certainly not making, any money right now, and I don't know if we ever will. We'll see what happens. It's a big question mark, but it's been really fulfilling. I'm in my 50s now, and my children, I've two in college and one in high school, and pretty soon I'll be an empty nester. And I think when that happens, you're really at a turning point. Your children don't need you as much. You want them to launch. And so, it certainly can be a turning point for women where we face a lot of mental health challenges too. Certainly as you're undergoing your own personal physiologic changes and health concerns. I think it's important that you still have something to give, you still have value. And so you have to find something, even if it's just a hobby. And I have friends who have suddenly dove into pickleball. And it sounds silly, but it's something they do. They become addicted, and it brings them joy. And so, just because you're 50 years old and you've done your, perhaps you've had a family and now that's over. I do think you have to look for something that can, sustain you, especially if you're still working emergency medicine shifts, that can really just be soul crushing, frankly, that you have something that you can give back to yourself. And don't be scared to take risks. I think that's ultimately it. Don't be scared to dive into something that you know nothing about. I think I read something about, I think Pepsi, they sold only so many cans of, Pepsi the first year, and, look at where they are now. Everything's going to take time, and it's scary, but the rewards can, really pay off.
All great advice and all great insights. So thanks again to Allie Bloom for teaching us all about ketamine and its safe and effective use for a new indication, and also for sharing a bit about how she and two other talented women colleagues have started a new business and a new venture, and are finding professional growth in that. So we appreciate your time today. Thank you very much, Allie.
Thank you.
And thank you for joining us in this installment of our M-Centric Shift Report podcast series. And special thanks to Dr. Bloom for sharing her important insights. For more content, networking, and innovation in the world of emergency medicine, please visit mcentric.com.